Assalamualaikum. I am Dr. Farjana Khanam, Assistant Professor, Department of Anatomy. Today I am going to give you a lecture about the connective tissue. This is one of the basic tissue in our body. It comprises more of the component is the fiber and the ground substance, and less component is the cell. So, to define a connective tissue, it is a main basic tissue, one of the basic tissue in our body, which consists of mainly the fiber and the ground substance and less abundantly the cell. To define a connective tissue, we have to know what is connective tissue, what are the components of the connective tissue, and different types of cell with its fiber and ground substance, and function of the connective tissue and the disease which are related to the connective tissue. First, the function of the connective tissue. Connective is the word which means connect. It connect the tissue between the bodies or the parts of the bodies. The connective tissue that connect and support our different parts of the body. Its main function, it makes a framework and protect our different organ in different way. Component of the connective tissue, it consists of fiber, cell and ground substance. The fiber named are the collagen fiber, reticular fiber and elastic fiber. The cell, there are two types of cell present in the connective tissue. One is called permanent cell or intrinsic cell, other one is called transient cell or migratory cell. The intrinsic cell are fibroblast, fibrocyte, undifferentiated mesenchyme, pigment cell, adipocyte. And the migrated cell or related or transient cells are called macrophage, mast cell, lymphocyte, plasma cell, monocyte, eosinophils and other WBC cells. And about the ground substance, that is very important, it is called intercellular ground substance or glycosaminoglycan. Here is a picture that showing that different parts of the connective tissue, that is the ground substance, different types of fiber and the cells in different ways. Now come to our first point, that is the cell. Which cell is very important for the connective tissue? The most important and most abundant and the most functional cells of the connective tissue is called fibroblast. This is a core tissue. Fibro means it act or secrete fibrous part, that is the fiber. So now comes to the structure. Cytoplasm of the fibroblast are more abundant and irregularly branched. Nucleus is large, ovoid, euchromatic and prominent nucleolus. Rough endoplasmic reticulum is much abundant and Golgi apparatus are well developed. In the fibroblast, there is a question why the rough endoplasmic is much more abundant in fibroblast. The answer is rough endoplasmic reticulum is main function to produce protein rich substance, and the fiber are protein in nature, so it contain more rough endoplasmic reticulum. Here is a picture, we can see there is a fibroblast with its different parts like nucleolus, nucleus and with its cytoplasmic processes. Now come to the function of fibroblast. Synthesize and secrete collagen and elastic fiber, synthesize glycosaminoglycan, involve in wound healing as a myofibroblast, influence cell growth and differentiation. The next important cell is the macrophage. It is a transient cell. It acts as an inflammatory stage or innate immunity, then it goes back to the blood. For the structure of the macrophage, the surface of the macrophage is irregular due to presence of protrusion, indentation or pellets. It is due to a process of pinocytic and phagocytic activity of the macrophage. Size and shape is variable according to their activity. Its nucleus is eccentric, oval or kidney shaped and it is a large nucleus. And the Golgi complex is well developed, and most important feature is the lysosome. There is so many lysosomes present in our macrophage. Here is a picture which show the macrophage. That is the one macrophage moving towards the bacteria, then it is engulfed, then the lysosome act on the bacteria fusing with the vesicle, bacteria being destroyed and digested. And the component we can see from here, that is the nucleus, nucleolus, Golgi apparatus, ribosome and different types of lysosome. Here is a transmembranic or TEM picture of macrophage, we can see the nucleus, nucleolus, granules like lysosome and different types of vacuoles. Now, what is the function of macrophage? Macrophage has different types of function. One of the most important function is phagocytosis of the foreign particle and the debris which present in our body, antigen presentation and processing to the immune cell, it secrete growth factors, cytokine and other agent. One of the important name of the macrophage in different types of tissue in our body or distribution and function of the cells of the mononuclear phagocytic system, that is monocyte which present in blood, that is called monocyte. Macrophage usually present in the connective tissue, lymphoid organ, lung, bone marrow, pleura. Kupffer cell present in the liver, microglial cell present in the central nervous system, Langerhans cell as in epidermis of the skin, dendritic cell in the lymphoid and the spleen, osteoclast cell as the macrophage seen in the bone, and multinuclear giant cell, that is the in connective tissue under various pathologic condition. Now comes to one of our second important cell, that is the plasma cell. So plasma cell, it comes from the lymphoid organ, so it is derived from the lymphoid cell. Now what is the shape of plasma cell? It is a large and ovoid shape. It consists of abundant rough endoplasmic reticulum and Golgi complex. One of the important feature of the plasma cell is the nucleus, generally spherical and eccentrically placed. It has an appearance like cartwheel appearance or clock face appearance due to presence of peripheral clump of heterochromatin. In the picture we can see that it is a bluish color or bluish violet in color, and the nucleus a dark color with a cartwheel appearance. Here is also we see a dramatic picture or diagrammatic picture, that is the nucleus, antibody and the Golgi apparatus, mitochondria. The most important function of the plasma cell, it produces antibody and helps in secondary immune properties. Now come to our important cell is the mast cell. The structure of the mast cell or the shape is the irregular and oval cytoplasm. The most important feature of the mast cell is the cytoplasm, that is abundant basophilic secretory granules. These are basophilic secretory granules. It can change the color often the staining, that called metachromasia, and the nucleus is the less prominent. In the picture we see there is several granules in the mast cell, which is most unique feature of the mast cell. Nucleus is less abundant and different type of fiber present in the cell, and the mast cell which bind with the antigen and degradation and degranulation and release different type of histamine. This is a unique picture of the mast cell. Now come to our function. It releases several types of preformed mediator like histamine, serine, heparin, cytokine and phospholipid, which act in local inflammatory response, innate immunity, tissue repair. Now there is a classification of connective tissue or the supporting tissue. There is a connective tissue proper, embryonic connective tissue and specialized connective tissue. The specialized connective tissue are the reticular connective tissue, adipose tissue, bone, cartilage, blood. And the embryonic connective tissue are the mesenchyme and mucoid connective tissue. And the connective tissue, the name of the connective tissue are the loose connective tissue, dense connective tissue, dense regular, dense irregular connective tissue. And in the next topics we will discuss about the fiber and the glycosaminoglycan or the covering or the supporting presence in the connective tissue, and about details about the connective tissue classification. So at the summary or at the end of the session, that we from this lecture we can know or we learn from this session that what is connective tissue, component of the connective tissue and the cells with their function of the connective tissue. Thank you very much.